Well, you have joined the doctor's edition, and I am Dr. Rita McGuire, one of the chief medical officer, one of the co-founders and the chief medical officer here at Wakana. And every Tuesday at 7 p.m. Central Standard Time, we present information for healthcare professionals. So a little bit about myself. I'm an obstetrician gynecologist of over 30 years. I practice here in Chicago. I graduated from Wayne State School of Medicine, completed my residency at Cook County Hospital. I'm the CEO of RJM Wellness and Ripped Rita Fitness. I'm also a global women's health and wellness speaker, really into health and wellness and fitness. I'm a certifying physician for the medical marijuana program here in Illinois and a member for Doctors for Cannabis Regulation. And of course, as I stated earlier, one of the co-founders and chief medical officer for Wakana. So whatever your field is, maybe you are a layperson, but if you're in the healthcare profession, I think it's really important that you understand this amazing plant, cannabis, and how it works in the body and how it can really assist so many challenges that our patients have during not only this global pandemic, but beyond. So our colleague, or my colleague, if you're not a healthcare professional, Dr. Sanjay Gupta really brought cannabis mainstream. He did that by one, saying no to cannabis, saying that there is no medicinal benefit to this plant and that it's harmful, and really no to pot. But after doing his due diligence and traveling the world and talking to experts and talking to patients, in 2014, he had to come back and absolutely make a public apology. He said that he did not do his homework and that we were systematically misled about this plant, and that yes, this plant, this cannabis plant, has medicinal benefits, and no, it's not a dangerous plant, and yes, it's helped hundreds and thousands of folks around the world to address and assist with so many different conditions. So let's look at the cannabis plant. Well, the plant Cannabis sativa has two species. Now, one species that really we should understand is the marijuana species. Now, that's the part of the plant or the species that gives us the high, the euphoria, the paranoia, the munchies. But what I didn't know 4.5 years ago was that there's another species, and that's the hemp species. That's the part of the cannabis sativa plant that doesn't give you the high, doesn't give you the euphoria, doesn't give you the paranoia. And it does that by having very little delta-9 THC. So delta-9 THC is the part of the plant and the compound that gives the reason why marijuana gives you the high. But what's also interesting when we look at the difference between marijuana and hemp is that hemp has industrial uses. Yeah, we can use hemp to make paper, to make rope, to make clothes. In fact, the very first automobile was constructed from hemp, and the very first Bible was constructed from paper made from hemp. So hemp has medicinal as well as industrial uses, whereas marijuana only has medicinal uses, and it does that by giving you a high, which many patients and people don't want to have. So marijuana has high levels of THC, whereas hemp has low levels of THC. Now, another characteristic between marijuana and hemp is the way it phenotypically looks. Its characteristics. Marijuana is shorter, it's fattier, bushier, It has more leaves and buds, whereas the hemp grows very tall, in fact, 20 feet or more tall, and the leaves are bunched near the top of the stem. But again, the most important factor that you need to understand is that marijuana has psychoactive side effects and hemp has no psychoactive properties. Now, when we talk about CBD, when we talk about the hemp plant, and we talk about our products here at Wakana, they are legal, and they're all legal under the 2018 Farm Bill. The Farm Bill was passed to allow hemp to no longer be a substance one, under a substance one category, meaning that CBD sourced from hemp can be legally sold, it can be consumed, and it can be cultivated in all 50 states. So with that being said, a Schedule I drug, which hemp used to be, it's no longer. And that is the reason why hemp sourced or CBD sourced from the hemp species should not have a negative stigma. It should be widely understood and taught in medical schools, and it should be widely understood and understood by healthcare professionals like yourself, if you're a healthcare professional on the line. So when we talk about the FDA has only approved one CBD product, and that's Epidiolex. Epidiolex is a prescription that is used for children who have seizure disorders, children who have Lennox-Gastaut syndrome or Dravet syndrome or tuberous sclerosis. Now, what's interesting about Epidiolex is that it costs $3,200. So it is a synthetic CBD product that is the only FDA approved product, but it's a very expensive product to utilize in the pediatric population. There are other products that are FDA approved. They're typically THC based. So these are products that are based from the marijuana plant and will give you a high, but they are FDA approved. This medication, Syndros, is used to increase appetite in HIV/AIDS patients. Excuse me. And again, it's about $1,500 for our patients. Marinol is another THC-based product. It's FDA approved. It is also used for those patients who have severe pain. They have issues with debilitating pain due to cancer or HIV positive. Sesame is another THC-based medication that's FDA approved in the United States, but again, it will give you a high. So all of these medications will give patients a high, a euphoria. Sativex is a THC and CBD combination. It's not approved in the US, but I did want to share with you. It's approved in the United Kingdom, in the UK, and again, utilized for those patients who have nausea, vomiting, or really debilitating pain due to cancer. So this is why this information is so important, because a lot of patients are looking to utilize CBD sourced from hemp. They don't want a medication that is sourced from the marijuana species because it's going to give them a high, but they're also looking for something that can help to reduce the amount of medications they're on, to help reduce the side effects that so many of these medications that they may be on without the high. So CBD sourced from hemp is absolutely a very, very, it's an alternative for those who are looking for an organic way of addressing their health. So these are some of the top reasons for using CBD. Our patients are looking for something that can help them relax, to reduce their stress and anxiety, to improve their sleep, to improve their pain, to offset nausea or vomiting, to help treat migraines. Even patients are looking to have a product to improve their skin care and even their menstrual relief and sexual enhancement. We're looking at those different age groups. You know, baby boomers are really the top consumers of CBD. We see each and every year those over the age of 65 are increasing their use from 8% to 49%. Even in the age group that I'm in, 50 to 64, we're seeing an increase from 11 to 36% use of CBD products. And then the Gen Zs, the millennials, their use is going anywhere from 16 to 20%, all the way up to now 30% in them using CBD products. So CBD or cannabidiol, again, can be sourced from the marijuana species, or it can be sourced from the hemp species. But tonight we're going to concentrate, obviously, on CBD sourced from the hemp species. One, because that's where all of our products are sourced from, and two, it is legal in all 50 states. So when we look at the benefits of CBD, there's over 20,000 peer-reviewed articles, and there's hundreds and thousands of publications that look at the medicinal benefits of CBD. So CBD can benefit the body in many ways. It can act as an antibacterial, it can inhibit cancer cell growth, it is neuroprotective, it can help reduce seizures and convulsions, it can promote bone growth, it can help to reduce blood sugar levels, it can reduce the function in the immune system, it can reduce inflammation, it can reduce the risk of arterial blockage, it can reduce small intestinal contractions, as well as relieving pain and anxiety. It helps to reduce nausea and vomiting. It helps to treat skin disorders like psoriasis and eczema and acne. And it's also a vasorelaxant. So it can come in and help to dilate vessels, improve blood flow in the heart, in the lungs, in the kidneys, in the liver. There are other cannabinoids like CBG and CBC and delta-8 THC and delta-9 THC. These cannabinoids work in a synergistic fashion to also enhance CBD as well. So we call it a full spectrum or an entourage effect, when other parts of the plant come together and really give the body relief that we're looking for. So the plant makes cannabinoids. Those are called phytocannabinoids. And one of the number one phytocannabinoid tonight we're talking about is CBD. You'll find that on the far right. But there's also endogenous cannabinoids or endocannabinoids. And that's what the body produces. Our body can make cannabis-like cannabinoids called anandamide and 2-AG that really help the body to maintain balance or homeostasis. And the reason why we recommend that every single person on the planet take CBD and consume it is because our body becomes deficient in the ones that it should produce. And the body becomes deficient by the endogenous cannabinoids because of the stress we're under, the food we're eating, the air we're breathing, the water we're drinking, the sleep deprivation that we're under, the fact that we're not working out. All of these factors really play into the fact that our body is not producing the anandamide and 2-AG like it should. So when we look at the science behind how cannabis works in the body, the science is called the endocannabinoid system. This is a very vital regulatory system that we all have an endocannabinoid system. It's made up of receptors. The main receptors are CB1 and CB2, But these receptors, when we consume CBD, they bind to the CBD, they bind to any of the cannabinoids that we're consuming in our products, and they send signals to different organs and glands in our body to put the body in balance. So you can see right in the middle that these receptors, CB1 and CB2, are found in different organs and glands. The brain and the central nervous system primarily has CB1 receptors, and CB2 receptors are primarily found in other parts of the body, like our eyes, our gut, our immune system, our kidneys, our liver, our pancreas, etc. And again, when we consume CBD, these receptors then bind and send signals to different areas of the body to keep the body in balance. So if we need pain relief, instead of taking Tylenol or Motrin or Aleve, we can consume CBD, and those receptors will then send a signal to the brain and the pain receptor areas to reduce pain. Or let's say we are utilizing CBD and we have an issue with sleep. We can't get to sleep, or we can't stay asleep. Well, when we consume CBD, those receptors in the pathway, like the serotonin and dopamine receptors in the brain, will release more serotonin and dopamine so that we can get a good night's rest. So now you can see that this science is real, and the endocannabinoid system is responsible for keeping the body in balance or homeostasis. Well, there's other things too that we should, as healthcare professionals, think about, and that is, does CBD interact with our medications that our patients are on? And the answer is yes. CBD is metabolized in the liver, and there's many medications that are metabolized in the liver. So when our patients tell us that they want to utilize CBD, we just have to look at their profile and just make sure that if there's some medications that CBD interacts with by inhibiting the medication or potentiating the medication, that we recommend that the patient utilize CBD in such a way where it's 2 hours separating the medication, a pharmaceutical medication, and their CBD. So a 2-hour window you should recommend to the patients. And if it's medications like warfarin or Coumadin, just check those INR levels more frequently. So the bottom line is that, yes, our patients can utilize the CBD, but they have to make sure that the medication is spaced out at least 2 hours so that they're not utilizing CBD and their pharmaceutical medication at the same time. Now, CBD can show up on a drug test. So that's why it's important that you recommend to your patients, if they undergo random drug screens, that they either use a broad spectrum CBD product or an isolate. A full spectrum product that utilizes the legal limit of THC, which is 0.3% or less, can potentially show up in a drug screen. In fact, there is a lot of research that shows that there is a 11 to 23% chance of a full spectrum product showing up in a drug screen, but that would take large amounts. That would take about 1,000 to 2,000 milligrams on a daily dose to show up on a drug screen, but let's not give any chance to our patients losing their jobs. So in that case, recommend either a topical product. Topical products don't pass the blood-brain barrier. Topical products that are now being utilized on a regular basis at massage centers, those products won't show up on a drug screen, but utilizing either a broad spectrum or utilizing a isolate will alleviate the chance of that person failing a drug screen. There are a lot of point of service or rapid urine drug testing that employers may use. those tests are not very sensitive or specific. So even in the case if that patient is undergoing a urine drug screen and they're using a CBD isolate, that urine drug screen, which is not sensitive or specific, may pick up CBD and call it THC. Those drug screens don't understand the difference. So LabCorp has a very sensitive urine drug screen that picks up the difference between CBD and THC. So that's just something you may want to put in your back pocket and recommend that that patient ask their employer to use LabCorp. LabCorp is one of the only lab that has a very sensitive urine drug screen. Now, another thing that as healthcare professionals should understand is that not all CBD is made equally. So if your patient wants to utilize CBD, you want to recommend that they only utilize products that are purchased from Wakana. Our products are utilizing hemp biomass or the hemp plant that's grown on farms organically. We source our hemp from farms that are grown in Colorado, Oregon, and California. Also, our products are extracted from a very clean extraction method, which is supercritical CO2 extraction. And all of our products require third-party testing. So all of our products come with a certificate of analysis. So yes, CBD is everywhere. CBD is at gas stations, they're at smoke shops, they're at video stores, but not all CBD is made equally. So you want to purchase and to recommend our products here at Wakana for your patients. Again, the supercritical CO2 method is the cleanest. It is the most expensive, but it is the cleanest for your patients and it's the cleanest for the environment as well. There's other ways of extracting CBD from the plant. There's butane and propane. They're not as clean and they're not environmentally safe as well. There's also a lot of different ways that your patients can consume CBD. There are tinctures, there's vape pens, there's smokable CBD joints, there's water solubles, there's edibles, there's gummies, there's capsules, there's topicals. Just know that your patient should really get into the method of layering the CBD product. So utilizing one product is typically not sufficient, but utilizing more than one. So utilizing the tincture and the gummies and the topicals is a great way to get the CBD into the system, into the bloodstream on a better, effective way. So let's talk about recommending our CBD products to maybe a diabetic. Well, one thing is that we can't make claims. So we can't make claims and say that the CBD product will cure their diabetes. But what we can say is that our CBD product will address the symptoms that we see in diabetes, symptoms of fatigue, symptoms of muscle loss, weight loss, slow wound healing and recovery, blurred vision, numbness and tingling, mood swings or irritability. And with all conditions, I'm recommending that you start low and go slow. More is not good. So starting with the lowest dose that we recommend is good because most people don't need a lot of CBD to address their symptoms. Even when we look at cholesterol, whatever the issue is with our patients, starting low and going slow is the best way to really address and assist with symptoms due to even cholesterol. Symptoms of loose stool, poor appetite, chest, stomach distension, aching pains, again, fatigue. A lot of these symptoms we can address with CBD. Well, when we look at the studies, there's a lot of studies, and I recommend for healthcare professionals that you utilize PubMed because PubMed has a lot of information as it relates to CBD and any sort of condition that you want to look up. This article talks about utilizing CBD in difficult to treat pain. Managing pain in medicine is one of the hardest things that we do as physicians, as nurse practitioners, as dentists, as pharmacists, as chiropractors, whatever your field is. Difficult to treat pain is a hard one. And what do? Oh, we utilize a lot of narcotics, which can potentially cause our patients to become addicted and cause our patients to have some pretty bad outcomes. We look at anxiety. CBD is a great alternative for our patients when it comes to anxiety, when it comes to depression, when it comes to PTSD, and other social disorders as well. CBD utilized in cancer treatment. When we look at chemotherapy, we look at radiation, it can cause a lot of side effects. So CBD can be an alternative for those who are looking for a reduction in nausea, a reduction in vomiting as well. GI disorders, the gut is the area that causes a lot of these comorbidities that we're looking at. So CBD specifically in diverticulitis or Crohn's disease or reflux. There's a lot of studies that talk about utilizing CBD not only for treatment in symptoms, but prevention in GI disorders. I do a Wednesday night call, which I utilize a lot of information that is ongoing with studies on CBD. So this was a call that I did with my recommendation of our products for diverticulitis and helping to reduce the inflammation, helping to reduce the pain, and then utilizing more than one product, our tinctures, our gummies, our edibles, and our topicals to address symptoms. So let's talk about some of our products. Our product line is combined with a power line or a full spectrum line in our pure line, which is our broad spectrum line. And we understand that there are so many areas or industries where folks can't use a product that will show up on their drug screen. So this is why we have our pure or our broad spectrum line and our power line, which is our full spectrum line. Again, this FDA disclaimer, the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA-approved research, and these products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information from healthcare practitioners. Please consult your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act require this notice. So we have products that are safe and effective. We have smokables, we have tinctures, we have edibles, we have topicals, we have healthcare, hair care, sexual health, and essential oils. So for your patients who are looking for any sort of CBD product, we have a product for them. We have certificates of analysis. Again, our certificates of analysis allow your patients to see that the legal limit of THC is there, 0.3% or less, that the product is safe and effective, that there's no mold, mildew, heavy metals, or pesticides or residual solvents in our products. And this is something that we take pride in Wakana, that we are transparent, and this allows your patients and even you to feel very safe that this product is safe and effective. Now, our tinctures are products that you utilize underneath the tongue. These, again, are products that are in the power line, the full spectrum line, and the pure line, the broad spectrum. Now, the tinctures are dosed twice a day. Now, the dosing is good twice a day because tinctures typically take about 15 to 20 minutes to get into the bloodstream, and their duration is around 6 to 8 hours. So utilizing the tincture twice a day, 3 drops underneath the tongue, is a great way to start at a very low dose of CBD. You know, after 4 or 5 days, you can let your patients know they can increase it to 8 drops twice a day. And then even if they need to have more, 15 drops twice a day is the recommended maximum dosing of our tinctures. So we have different milligrams. We have a 300 milligram broad spectrum. We have a 500 milligram or a 900 milligram tincture. And we also have a water soluble for your patients out there that want to put their, got my big gallon of water I'm drinking here. If your patients want to put in their water, their smoothies, their teas, whatever is liquid, they can put the power water soluble in the liquid. Now, what I love about our product line is that we've enhanced our products. So we have a proprietary formula on many of our products where we, in our Hempranium 500 tincture, we've included black seed and turmeric and peppermint. We've infused these essential oils to enhance the antibacterial properties of CBD, to enhance the digestive properties, and even help to improve blood sugar levels by adding black seed in our Hempranium 500 milligram tincture. Now, our topical products are really products that offer local relief, and all of our topical products are power products, but they will not pass the blood-brain barrier, which is a great thing because those who want to utilize and have random drug screens at their job can do that very safely with our power products. Our extreme pain relief is our #1 topical selling product. It is enhanced with essential oils like turmeric and peppermint and spearmint that really, and eucalyptus, that enhance the anti-inflammatory properties and pain relief properties. Our liquid, this is a cream, but our liquid power relief cream is a roller ball. So you can utilize that, your patients can utilize it very easily by adding that to their sore joints and muscles to offer local relief. Our serum, facial serum, is a great product to help reduce wrinkles and to address anti-aging and help to reduce skin conditions like psoriasis and acne and eczema. So we've got some great topical products as well. And then we have our edibles. We have our gummies. We have our coffee. We have our gummies, our power gummies, our full spectrum or our broad spectrum gummies, and our sexual enhancement gummies, our King of the Jungle gummies. We have our Delta 8 gummies, which is a new cannabinoid that gives more creativity. Our Gen Zs and our millennials specifically love our Delta 8 gummies. And then we have our flat belly gummies, our gummies that really address weight loss, weight management, and of course, our flat belly brew, which enhances that weight loss by reducing the appetite and reducing the cravings for sugars and carbs. Our essential oils are all organic, of course, as well. Our First Defense utilizes a CBD and essential oils in a nasal spray that helps to reduce those viral loads and bacterial loads in the nasal passages. Our smokable products work fast. So within 1 to 5 minutes, we are getting relief from any conditions or assistance with symptoms that we may be needing, like an acute onset of a migraine or acute onset of a gout attack or acute onset of a social anxiety, right? We can utilize the smokables, and within 1 to 5 minutes, they will take effect. Our smokables include our vape cartridges. They include our CBD and our Delta 8 pre-rolls, as well as our premium flowers. Our culinary products, our spices, our vegan butter, our Culinary Plus tincture, these are all products that you can utilize in the kitchen, not only to spice up your recipe, but to also address those symptoms that we talked about that CBD can enhance and to assist with. Our hair care system addresses alopecia, hair loss, hair thinning, excessive shedding. We understand that alopecia is a global pandemic. Because of the COVID infection, a lot of folks lost their hair. And this system, which includes shampoo, it includes conditioner, leave-in detangler, styling cream, our empowered hair, our beard and scalp products, all enhance the ability for the hair to retain its luster and to grow that hair back that's been lost. We have our sister company, which is Royal Defense. We have products that maintain safety in our home, in our office. We have a produce wash. All of these products are a CDC approved to help keep our home and our office safe. Our sexual health products include the King of the Jungle gummies, but also our CBD lube. Our CBD lube enhances that moisture that is lost in the vagina and also helps to enhance the sexual encounter. Even with those women who are menopausal, have low libido, have vaginal atrophy, these products help to regain that to both men and women. So there are so many great choices. You know, you and your patients can't go wrong. So hopefully now as healthcare professionals, you understand what CBD is, how the cannabis plant works in the body, the endocannabinoid system, and how there are so many great products that your patients can trust and you can trust as well. So I want to thank you for your time. I've listed here my email address. If you have questions, concerns, critiques, you can always email me at ritamd@wakana.com. You can join us at 8 p.m. in the next, 20 minutes on our 8 o'clock business overview, where you'll get some more information about the opportunity here, as well as product overview and our leadership. Here's the Zoom ID and passcode. You can screenshot that and join us at 8 o'clock. Also, if you're guest on the line, please connect with the person that invited you. So that person can get your products ordered, that person can get you plugged in. If you're a healthcare professional and you want to join our Wakana Medical Advisory Board, they can help you with that as well. So I want to thank you for joining, all of our business partners, all of our guests. I invite you to the 8 o'clock call, and I want you to continue to invite your healthcare professionals to this 7 o'clock call done every Tuesday. Be well, be safe, and we will see you in the next 20 minutes.